Let's continue with the rest of the recording on states of consciousness. This is, as you recall, Psychoactive Drugs, Module D, Part 2, and where we continue with different categories of psychoactive drugs. Depressants. Psychoactive drugs that act as depressants are decreasing activity in your central nervous system. So in other words, we take these substances as a way to feel calm and relaxed. And certainly the first drink a person feels may have that effect. It seems to calm you, to relax you, but also start to enliven you. And then so it seems like a little bit of a contradiction, if you will, in the way it reacts in our body. But the more we consume, the more our central nervous system becomes depressed. In other words, a person who has, let's say, 7 or 8 drinks, depending on your tolerance, and tolerance on alcohol depends on weight, it depends on how much experience you have drinking, it depends on whether you've eaten anything, it depends on your gender in some cases. But what happens is that the more a person drinks, the more they become uncoordinated. They can't walk as well as they could. They can't talk as well as they could. Their speech becomes slurred. Their ability to process things takes them a little bit longer. They make poor judgment calls, which is why sometimes a person might get behind the wheel of a car after they've had too many drinks, because they think, I'm not drunk, I'm fine, I can do this, I can get there. And it is really our #1 drug problem in Canada is alcohol. And it's because people see it on one hand as socially acceptable, and on the other hand, they use it as a way to self-medicate their pain, their suffering, their challenges in life, rather than dealing with them. The other issue with alcohol, though, is that people who consume it may become more aggressive, especially men. They may have difficulty to form memories. They may forget about that night of drinking too much. So alcohol can be quite severe. Barbiturates, such as Secobart, Barbital, Seconal, Pentobarbital, Nembutal, they are sometimes called downers. People who take these barbiturates become drowsy, they become confused, their thinking, their judgment suffers, their ability to react in a situation becomes impaired. They have more challenges in terms of staying awake. And some people take these in combination with alcohol, and then when they may have fatal consequences. In other words, a person may die as a result of taking some kind of barbiturate with alcohol, particularly barbiturates like benzodiazepines. The last group that I want to talk about here, the narcotics, are pain relieving and calming, and are used for medical purposes. Again, if you've had surgery, immediately you may have some, or while even you're having surgery, you're having some kind of narcotics to help you cope with the pain. But if you're just taking it for other issues, or for nothing to do with surgery or a chronic medical condition, then it can become deadly. It's highly addictive. It can cause this sudden rush of euphoria followed by drowsiness, and those withdrawal symptoms happen pretty quickly. People report nausea, depression, diarrhea, and because their symptoms are so severe, a heroin addict is motivated to get another fix so that they don't have to deal with those negative symptoms. And this is when overdoses can happen. Okay, let's move on to talk about hallucinogens. Things like LSD, ecstasy, marijuana even is considered a hallucinogen. And you may think that marijuana is fairly harmless. Just you take a joint. In fact, when I teach this in class, a lot of students say, yeah, miss, I've smoked marijuana. I smoke it all the time. I'm fine. I'm totally okay. And because it is widely used, and it is even to the point where the Canadian government is considering decriminalizing it and making it legal. Does that mean it's okay? Well, it depends. It can promote relaxation, lower inhibitions, lower your anxiety. But what happens if you take a lot? The active ingredient in marijuana, THC, or tetrahydrocannabinol, binds right on the cannabinol receptors in the brain. And what happens is that person feels this high, this euphoria, but it remains in the system for days or even weeks. It attaches to the cannabinoid receptors in the brain, and it starts to mimic our own body's normal production of cannabinoids, which are important for attention and coordination. But because you have so much of this in your system that it's increasing the availability of it and increasing the reuptake of it from your body, from the brain, you have more difficulty with coordination and reaction, and it makes operating complex machinery a little bit more dangerous. So again, a person who has had ingested too much marijuana may get behind the wheel thinking that they're fine and find out that they are not operating this vehicle as safely as they would without it. Let's move on to ecstasy. Ecstasy and the picture that I have here as well of bath salts are what are known as designer drugs. They are laboratory created. And so they can be a cross between hallucinogen and amphetamines. The appeal is this pleasantness that comes with it. You feel connected, you feel more uninhibited, you're able to be yourself around other people. But what's the price that you pay for this euphoric or joyous state that you might get from the ecstasy? Memory problems, ability to pay attention is impaired, your thinking and self-control are impaired, and in extreme cases, such as what's shown on this particular slide about bath salts drugs, you could have a cardiac arrest, chest pains and cardiac arrest. You could become severely agitated and suicidal, and maybe even act on those suicidal thoughts. So it can be because it's artificially created, you don't know necessarily what all the ingredients are and how that's going to affect what kind of reaction you're going to have. I used to have another graphic that I couldn't find when I was putting this slideshow together that had a a wheel, sort of spin the wheel and see what you get when you take bath salts, because you could get any one of these things that are on this particular drawing, or you could have them all, and depending on how your body reacts to this synthetic substance that you're putting into it. And finally, LSD, or acid. The person who takes LSD has hallucinations and mental distortions. They may think that they can fly. They may think that they can do things that they normally wouldn't even attempt if they were not ingesting this particular substance. And lasting within our system for 10 to 12 hours, and those reactions can cause a bad trip where you do something harmful to yourself, self-harmful, or it could be a good trip, so to speak, where you have this sense of euphoria. But again, it depends on your own body chemistry, how you react to a particular substance. And it may, for some people, it may be fine in small doses. For others, even a small dose could have negative, harmful effects. So when we take drugs, how does it affect our brain? Excuse me. Well, for one thing, it increases the availability of dopamine. And dopamine is a key neurotransmitter within our brain that plays a significant role in our feeling that we are being rewarded, that we are doing something that is pleasurable, and we feel good about ourselves. We feel connectedness in some cases, depending on the particular drug. Certain drugs can act on endorphins. So, as I mentioned before, what happens is that when you take a substance, it binds to a neurotransmitter in the brain. So, for instance, opiate, they mimic the reaction of endorphins. And as we know, endorphins are useful for helping to relieve pain. So you take this opiate and it binds on your neurotransmitters, or neurotransmitter receptors, and it causes us to feel that temporary relief of pain. But again, because it's temporary, we may end up taking more of it, and again, that increases the availability within the brain. So the brain is constantly producing more as a result of this binding to the receptors. And the same with alcohol and barbiturates. They act on GABA receptors. And if you remember about GABA is primarily an inhibitory neurotransmitter. It slows down our central nervous system. But then if you take too much of it, what can it do? Well, it can kill you, because your central nervous system is so slowed down, it becomes deadly. So, with all we know about drugs, why do people take them? What is it that causes people to want to experience these negative symptoms? The short-term positive symptoms? Possibly. Possibly it's more about the recreational circle of people that one associates with. Possibly it's about that pattern of behavior that a person has learned to engage in. But what happens is that when we look at people who take large amounts of any substance, they have several different reactions. Let's talk about the toxic ones. The toxic and other biochemical effects will affect your physical health. So it's no coincidence that people who are alcoholics or have a lifelong dependency on alcohol or nicotine have more chronic disease as they age than do people who don't. But it's not just those long-term chronic diseases that can occur. Sometimes we have accidents and acute diseases. So for instance, a person who is ingesting a lot of alcohol may not be walking well and falls down the stairs and breaks their leg. They don't even realize how much they've ingested necessarily and don't feel the pain immediately because they are so high, if you will, on the alcohol, or so absorbed in the alcohol. And then they have the next day, when they're going through that withdrawal from the alcohol, they start to feel this acute pain and may end up having to go and get a hospitalization or medical attention for that particular injury that they sustained. This is as well as motor vehicle accidents that happen as a result of people who drink and drive. Thankfully, there are fewer of those than there once were, but it's still a significant problem in our society. The second group of effects that I want to talk about is the psychoactive effects of intoxication. So in other words, a person drinks, they feel pleasure, they take drugs, they feel this pleasurable intoxication level, they feel this, they can relax, they can tackle different problems, they can have more time. But again, their judgment is impaired and they may make decisions that could lead to accidents and chronic disease. But let's introduce a third one, and that's social problems. So for instance, a person who drinks a lot, who has a problem with alcohol abuse, may have issues fighting with their partner all the time. At one time, I worked as a counselor with women who had come from abusive relationships, and they would use the excuse that my partner would only do this when he was drunk. Well, he would only beat her when he was drunk because of the loosened inhibitions to do that. He obviously had some predisposition towards it. But you can see that to do that on a regular basis, we can look at the chronic social problems, such as marital breakup, family upheaval, long-term challenges in a family dynamic, etc. So unfortunately, it's sort of the things in the latter part of this block that are the ones that we are most concerned with. The chronic diseases, the accidents are obviously significant problems, but the social and family breakup problems are maybe harder to deal with until the person learns to control his or her use of a substance that they have become dependent upon. Okay, so that's the end of this chapter. It was a rather long module, but next chapter we're going to start talking about learning, and we'll bring in some of the issues that we talked about in this chapter, sort of carry them forward in learning, as in learned behaviors of addiction and how we learn by association. Okay.